Hi guys, my name is Shishir and I'm the founder of Medloop, and today I'm going to tell you a little about how we're changing healthcare from reactive to preventative as it should have always been. It is common knowledge that chronic conditions are becoming healthcare is becoming increasingly commoditized. Right? Back in the 50s, your family doctor was a real family doctor. He came to your home, he knew about the ailments your brothers and sisters suffered from, and prescribed treatments accordingly. The care delivered may not have been as sophisticated, but it was surely very holistic. That relationship today is completely lost. My GP, he doesn't even know my last name, let alone the family conditions I might be predisposed to. But who can blame them? These doctors are seeing, on average, about 243 patients a week, and each consultation lasts about 7 minutes in length. And so as the general practice has undergone the sea of change, it's shocking that their tools have largely stayed the same. I mean, these tools were made in the 90s. They bear no connection to the patient. There is very little or no exchange between the patient and the physician in terms of medical data both ways. And there's little to no automation in place, which forces doctors to take copious notes during consultations rather than spending time with the patient, further dividing the gap between the doctor and the patient. And so we looked at these care gaps and we built a patient management solution from the ground up. This solution is founded on two main pillars. One is really reviving that lost connection between the doctor and the patient and enriching it with prevention. And the other one is to build in more and more automation into the general practice to better equip doctors to be able to service an ever-growing GP register. And so, as you can see here, Medloop is an integrated tool for both doctors and patients. For doctors, we offer a population management tool, which gives them an overview of all of their various disease dashboards and a direct connection to every patient in it through the patient app. With the patient app, for patients, we aggregate all of their care needs in one place, whether it be booking online appointments, getting lab results, requesting prescriptions. But more importantly, we empower patients by delivering to them tailored notifications and alerts about how best to optimize their care and about their upcoming care processes. These notifications are delivered by a proprietary rule engine, which looks a little bit like this. So we have the Medloop rule engine running on the cloud. The rule engine is powered by clinically proven evidence-based rules from leading health organizations like the NHS, the KV in Germany, and also the NICE-based guidelines. And this rule engine is then embedded onto the patient EMR and runs in the background, and then when appropriate, triggers alerts and notifications to the patients and the relevant caregivers, depending on the complexity of the rules. So for simple processes like an HbA1c score, or your blood pressure, or your blood review, patients and nurses are notified. And for more complex procedures like a retinopathy exam or a cervical cancer screening, the patients are summoned into the practice and the doctor is notified to do these procedures. So in this way, our integrated approach firstly empowers the patient by putting them in charge of their own care and upcoming care processes. It optimizes the disease register of the doctor. And lastly, it frees up a lot of practice time, as not all patients need to be brought into the practice for a treatment. And so for this tool, we charge 89 euros a month. We have two other products live in the market, primarily in Germany. One is the Medloop Lite, which aims to digitize the practice at the front desk in terms of registration, et cetera. And then we have the Medloop Practice, which is really an end-to-end practice management software with billing and the waiting room and the patient EMR and all of that integrated that can replace the whole software, the legacy system that the GP uses, and can run the practice based on that. And in terms of competition, you'll see here that the incumbents that we're up against are companies that were largely made in the 90s, at a time when their healthcare system operated a fee-for-service model, and prevention was mostly an afterthought. And so we enjoy a unique position here at a time when the healthcare environment is changing to more of a value-based care model. And in order to capitalize on it, we've been extremely busy since incorporating in April of last year. We basically set out to first acquire our certifications. These are regulatory certifications needed to operate in our target markets. So in Germany, we acquired the KV certifications to be live there. And after a year of a rigorous process, we succeeded to integrate with the NHS. We've integrated with one of their largest suppliers, which allows us to bring Medloop to 33 million users in the UK. They can simply download the app from the App Store, connect with their linkage key, and start using Medloop. And then we launched apps in both markets, in Android and iOS, in early this year in April. Soon after, we went live with our first practice in Germany. There's a practice in Berlin of 3 doctors and 10,000 patients. We followed suit with going live in our first practice, another pilot practice actually, so not a paying customer, in the UK. It's in London, reasonably large size practice as well. And then just a couple of weeks ago, we were awarded the tender from the NHS to be centrally procured. What this means is that if a patient uses the Medloop app or a doctor uses the population management tool, we're going to be paid for it centrally by the NHS. And just last week, we won our first customer in the German market, and from what I'm informed this morning, we won another one. So that's good news. In terms of numbers, we've done little to no marketing, and we've got about 1,500 users using the app, using various online services like getting their lab results, 1,500 appointments booked. They belong to 50+ practices, and we have about 32 doctors signed up or already using the population management tool with an addressable patient register of 50,000 patients. So today we're looking to get in more senior talent in terms of sales and with a medical background, and also looking to close our A round. So thank you very much, and I look forward to talking to you all.